So let's just take a few minutes and go into the therapeutic protocol relative to the science of the 3 phases of healing. So what does the typical chiropractor do relative to the science of the 3 phases of healing? Well, remember, there's the inflammation, repair, and remodel phase. There's 3 phases of healing, okay? The inflammation phase is typically 72 hours. The repair phase is 6 to 12 weeks. The remodel phase is up to 12 months. And how quickly somebody heals typically depends on 2 factors. Their age. The older we are, we don't heal as quickly. And how long we've had the problem. Generally, the longer we have a problem, the longer it takes to get over it. And sometimes we'll never get 100% over it, okay? So those are the 2 most important factors. But typically what happens in the inflammation phase is the chiropractor will typically use passive motion. So the goal in the inflammation phase is decrease pain, inflammation, decrease muscle spasms. So the typical therapeutic protocol here is the chiropractor will use muscle stim, helps decrease muscle spasms and acts as a nerve block to help decrease pain. Cold packs are good for decreasing, constricting the vessels that decrease inflammation and decrease muscle spasms. So muscle stim is good, cold pack is good. Cold pack also decreases the nerve conduction or the pain signal. Passive motion therapy, that is very good for taking the patient through passive motion. It helps block the nerve signal, and that's right from the gate theory of pain control. So sometimes chiropractors will use laser therapy. Laser therapy is very interesting in that our cells, when they're normal, depending on the anatomy of the cell, they have a vibration, a certain vibration rate. When they're not healthy, they'll vibrate at a different vibration rate. And what a laser does, I'm talking about a cold laser. A laser light goes in there into that anatomy, and it vibrates at the healing vibration rate. So that's how laser helps to heal tissue. It's a very interesting phenomena how that works. But those are some of the very common, and there's a lot of different therapies to help with inflammation. And then there's also supplements. There's supplements that are good to help decrease inflammation. And then there's herbs. So you got herbs, supplements, physiological therapeutics. All of them are good to help decrease pain, inflammation, especially without side effects, especially, okay. So that's typically what the chiropractor will do here. In the repair phase, that's where the adjustment is really important because it will affect all 3 ranges of motion, active, passive, and joint motion, with the joint motion being the most important. So that's real important here. And then typically, depending what else is going on, how many other symptoms are going on with the patient, then the chiropractor will still do some therapy. Like if they still have some muscle spasms or tension or their spine's not moving properly, they may get some passive motion in the joint with the chiropractic adjustment. These are very common therapeutic protocols. And then in the remodel phase, remember the goal there is to increase the strength and the elasticity because that type 3 collagen is not as strong. And so that's the goal, is active resistance exercises. Some of the good therapies are active resistance exercises, exercise themselves, and something called reciprocal inhibition is very good for that. But this is rehab. The remodel phase is rehab, and that's the reason for rehab, is to increase the tissue strength and elasticity to decrease the likelihood of it being a permanent problem and it coming back. That's the reason for rehab. So this is why and how chiropractic works. And so people every now and then say, when you don't know any better, somebody may say, well, once you have to go to a chiropractor, you have to keep going forever. Well, that's not the case at all. So patients can choose. Patients can choose to only get inflammation care. They can choose to only get inflammation and repair care. Or they can choose to get inflammation, repair, and remodel care. See, there's different phases of care based on where the patient is healing, how they're healing. And how the chiropractor knows that is through the examination, the tests. The tests tell us not only what the problems are, the tests tell us how well and quickly the patient's getting better or not getting better. That's what all the tests do. So that's why we'll do the re-exams. But that's why patients might be on a schedule 3 times a week or twice a week or something like that, is for the physical medicine, not only to decrease pain and inflammation, but the physical medicine part. Remember, you have to apply, and this is what's really interesting about the chiropractic adjustment, is when the chiropractic adjustment happens, there's several things that happen. It helps decrease nerve sensitivity, number one. When we actually adjust the spine, it stimulates the mechanoreceptors, the nerves around the joints. And essentially it sends a signal to the spinal column to block the pain. And that's why a third of patients, when they get adjusted for the very first time, immediately feel better. So that's what happens with how chiropractic helps relieve the pain from what's called the gait theory. Another thing that happens when you do the adjustment is it increases. Now remember, we're going into active, passive, and joint motion. When we actually do the physical adjustment, that energy that goes in there, this is called kinetic energy. When movement is kinetic energy. So we put energy into the spine, it's kinetic energy, and it's a certain line of direction. And this is what's so important about the line of direction, is remember the collagen that goes into that tissue, remember it goes in as a matrix. It just randomly goes down there, and that's not a good thing because that's what makes it weak, and that's what allows for trapping of those nerve endings in there. And if it heals that way, now you have weaker tissue and it's more painful. So that's not a good thing. So the chiropractic adjustment does a couple things. Number one is it helps to increase the active, passive, and joint motion, all 3 ranges of motion within that joint to help get it back to normal, number one. But also what happens is when we apply that kinetic energy, it's transferred into electrical energy. And that's called the piezoelectric effect. Piezoelectric effect. Kinetic energy transferring into electrical energy. And it's the electrical synapses, it's the electrical responses that tells your body whether to produce something or not produce it. So like in bone, if there's too much stress in one area of a bone, you'll start getting bone spurs. Well, that's from the body sending an electrical impulse saying there's a lot of stress here. We need more support here. Pack more bone over here. So that's what happens with bone. Well, the same thing happens with soft tissue. When we adjust the soft tissue, and it's called Hodges effect, is that kinetic energy gets transferred into electrical energy, and it's the electrical energy that helps form the alignment of the collagen. That's the stimulus of the collagen. So this is how chiropractors help to take these injuries, and they have this random maze of collagen after an injury, and that's why you can get adjusted during this repair phase of healing. And instead of it being a random maze, it all starts to line up. Well, when those collagen fibers start to line up in that specific direction that the chiropractor is adjusting, what happens, and remember it's from the kinetic energy going into the electrical energy that stimulates that growth pattern. And so what happens is when the fibers are in line, they're much stronger, so you don't have as much weakness. And not only are they getting back to being normal as far as strength, but now you have a decreased likelihood of those nerve fibers getting trapped, which decreases the likelihood of trapped nerve pain. So this is what happens with the chiropractic adjustment, how the chiropractic adjustment helps decrease pain through the gait theory, helps increase active, passive, and joint motion, all 3 ranges of motion, helps affect the connective tissue in its strength, in the elasticity, help with mobility, and it helps to decrease pain also from the nerves being trapped. That's why that chiropractic physical medicine adjustment is so unbelievably important, and that's why so many people feel so much better. But that's why also you have to get treated 3 times a week, twice a week. You have to get treated at a somewhat frequency. And I'll give you a really good example, is if you just lift weights once a week. Well, when you lift weights, that's kinetic energy going into electrical energy that's stimulating the muscle growth when you lift weights. Okay, so if you lift weights once a week, that's not a very high frequency. You won't have much stimulation here for that muscle. Well, it's the same with the chiropractic adjustment. When you get adjusted 3 times a week or twice a week at a higher frequency, especially during the repair phase of healing, that's when it's really important. Then there's enough energy going in there that's stimulating, say, grow, 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 grow. And because of the line of drive, it grows in a particular formation. It grows in a particular alignment. And that's why we'll see somebody 3 times a week or twice a week, okay? Now, do patients have to do that? No. Patients can opt for only inflammation care. They could not opt for repair care. Of course, that would be foolish. The likelihood of a permanent injury would significantly go up. And then patients can opt for rehab or for the repair, for the remodel phase. So do they have to take remodel therapy? No. But is it helpful in the healing process to decrease the likelihood of a permanent injury? Yes. So these are the 3 phases of healing relative to the therapeutic protocol. No patient has to go through any phase. Some patients can pick only 1 or 2 phases. But most patients I've found, when you explain all of this to patients, there's not many patients that will say, well, I only want this, and I'm okay with this being permanently abnormal the rest of my life, the repair phase, and the remodel phase, I'm okay with that being permanently a problem the rest of my life also. See, that's typically not what they'll say. So as long as we make it affordable, and it's not extremely expensive, and we don't waste their time, we make it time effective for them to come in and get treated 3 times a week or twice a week. When they hear this, who wouldn't say, what normal person would not say, yeah, I'd like to get the inflammation phases back to normal as much as possible. I'd like the repair phase to get back to as much as possible. And I'd like the remodel phase to get back to as much as possible so I don't have any pain or discomfort with work, sleeping, cooking, cleaning, laundry, putting clothes on and off. And I can have a full life, as opposed to not having the therapeutic protocol, and then the body starts healing wrong. Healing wrong meaning you have increased nerve sensitivity. Those nerves get trapped. What does that mean? It means when the patient's at work and they try to move in a particular direction, it hurts. Or it's not as strong, so they re-injure themselves. And it's not as elastic, so it's stiffer. So this is why when patients heal wrong, they're stiffer. It's not as elastic. That's why you feel stiff. That's why I feel painful. This is why people alter how they bend and move, how they get out of bed, how they wash their hair after injuries. So this is the difference it makes. So when patients understand this, and we make it affordable, and we don't abuse their time, who wouldn't say, yeah, I'm definitely in, let me get back to 100% normal or as much as my body will allow, as opposed to saying, there's not a whole lot of people that'll say, yeah, I'm not interested in this other stuff and I'm okay with having a permanent injury the rest of my life. There's not a lot of people that think that way. So this is how chiropractic relates to the 3 phases of healing, what we do physiologically, how it helps the patient, and of course, all of this is explained to patients. They make the choices, and then all we try to do is make it affordable. We just try to make it affordable for them to come in, and we don't want to waste their time. We don't want them to come and wait. We want to make it where they can get in our office and get out. We want to respect their time. We do that. We stay pretty busy. We help a lot of people. Okay? All right, let me leave it like that. You do have to know this. You have to know, if you're a CA, you have to know the 3 phases of healing. You have to. The very basics you have to. I mean, you may have to explain it to patients to a small degree, okay? But you have to know the basics. And it's obviously very good to know the difference between what does a chiropractor do versus what does a general practitioner do versus what does maybe a physical therapist do? And that's what we covered. These are the pros and cons of chiropractic's role in the healthcare industry. Okay.